Dave, why are you so passionate about mental health?
Oh, look, it's a hard question to answer briefly. I got into psychology after sort of being exposed to a leadership and personal development program when I was in my early 20s. And, for mine, looking at how we utilise programs, resources, professional services, as well as, a range of sort of initiatives to better mental health is what keeps me really passionate and interested about the field. I love doing what I do because I'm learning every day, and that learning takes us towards providing better services for men, and focusing specifically on mental health.
And have you had your own personal experiences?
No, I haven't. Apart from what I would consider probably normal life experiences, loss of relationships, loss of friends to death, really difficult periods. I'm just thinking about the last sort of 6 months. We've just welcomed a young daughter into our family.
Oh, beautiful. Congratulations.
Thank you, mate. It's such an amazing experience, and incredibly challenging. So, whilst I've never been diagnosed with any sort of mental ill health or a mental illness, I've faced some pretty challenging times as a result of my background. Serving overseas with the Australian Army and supporting people through some pretty challenging experiences.
And those experiences, have they informed and inspired some of the work you do now in terms of what you've seen from others?
Yeah, 100%. So, we set up MANTLE as a result of our previous experiences and identifying, if I look at myself and my other two co-founders, Dave and Luke, two of us have sort of long-term experience in the Australian Army as psychologists. Dave has also done some reserve work as well. And for us, outside of Army and the broader corporate experience that we had and my experience in high performance settings, we identified that men require something different when it comes to professional psychological support. And that was the reason that we started to look at building MANTLE.
And just on that, what did you identify? What kind of gap was there? Did you see, and what needed to change?
Well, if we look at what psychology is, it's about 80% female. A lot of the frameworks, the approaches that you utilise in psychology is sort of based on what has largely been a female audience. And that's sort of based on, there's a range of reasons. It can be the male masculinities, it can be the stereotype, the stigma. What we identified as a result of our own anecdotal experience and then backed up by the research that we were looking at is that men require something different. And when we talk about what that difference is, it's about how we engage in therapy, how we sort of approach each session, how we ensure that we're looking at it to maintain a level of autonomy for the client wherever possible. So, how do we make them feel like they have a sense of control, if you like?
Yep.
How do we ensure that it's activity-based, less about sort of talking about delving into thoughts and previous experiences. It's how do we sort of build that rapport through encouraging them to act. And the third point is, how do we sort of leverage their strengths, the things that they do well, as a means to help them improve whatever it is that they're going through. And that was supported by research, which is really cool.
And how pivotal is it for men that they feel like they're the ones driving their own experience of therapy?
It's what allows you to build a solid and therapeutic relationship, but a solid relationship. You need that rapport because, what the research tells us more broadly is it's not the framework or anything that you might apply in when you're working as a psychologist. It's actually the relationship that you have with the person that you're working with. And so, when we look at how men operate, and this is stereotypical, but it's largely accurate. What we need to do is we need to make sure that they feel like they have a sense of control or this notion of autonomy over what they're doing and the direction therapy is going in. Because a lot of the time when they experience periods of mental ill health or mental illness, some of that sense of control or autonomy has been eroded for whatever reason in their normal life. And so we've got to start sort of trying to rebuild that as a means to start to move forward.
And I suppose if men are feeling disempowered or like they've lost some of that control and they feel like to be a man and to be the masculine entity they're supposed to be in control, then there's shame that comes along with that and it sort of turns into a bit of a vicious cycle.
it's a really interesting one, and the research around sort of how we approach masculinity is critical, and having an awareness of that. So it's not just like this notion that we all have just one masculinity. It's sort
fluid.
of more diverse than that. When we approach these sort of environments, we acknowledge that, in certain situations, there needs to be a level of, I guess, control. There needs to be a level of stoicism. There needs to be a level of suppressing emotions if we talk about some of the things that people might need to do for their job, whether it be military, whether it be fireys, ambos.
And there's nothing wrong with that in certain contexts. In fact, it's perfectly necessary, and we shouldn't have to feel like we need to give up parts of being a man that are perfectly natural, but it's also staying open to and accepting all the other diversity that comes along with being a man as well, and not trying to fit everyone into a very restrictive box of what they can and can't be.
Yeah, look, 100% like that. And, that works in certain settings, but we acknowledge the many roles that we fulfill in life, and the capacity to show emotion and discuss emotion at a family level with your significant other, your children, your brothers. That's a necessary part of building a trusting and effective relationship. And sure, it might not be appropriate in certain work settings, but it's a necessary part of being a man in other parts of the way we live. And that's sort of expanding this understanding of what masculinity is, and this notion of multiple masculinities, if you like.
Yeah, it's a big job. It's going to take a bit of time, but I think we're starting to work at it. So the narrative's been that men don't go and seek help, and that's the big problem. Men don't ask for help. But I think that the facts are that that's actually changing. A lot of men are seeking help now, but the retention rate is quite a big issue. I understand where men might perk up the courage to go and see a psychologist, not have a great experience the first time, and then never come back again. And it actually swings the other way and has that effect where they feel like, oh, psychologists don't work for me because I had one bad experience. And we know that not necessarily even a bad experience, but someone who you don't click with is pretty likely. I think it's something like 4 or 5 psychologists is the standard before you find one that actually really suits you. So what do you guys have in place to try and push that retention rate up?
Yeah, really good question, Callum. So the way that we approach it at MANTLE is a couple of ways. The psychologists that we have as a part of our service, our team of psychs, they go through sort of an onboarding and refresher program that goes into a lot of the research around a gendered approach to therapy. We also give our clients the opportunity, if they don't sort of feel like they're gelling with their first psychologist that they're sitting with, they can change over to another therapist without any sort of problem there. My perspective is that should be a standard practice across all psych support. If you're a psychologist and you're sitting there and you're not feeling like you're connecting with the individual, then having that conversation, and this is one of the critical aspects that engenders positive experience more broadly, having that conversation with the client around, well, hey, I don't think this is working out for us. What's your perspective? Would there be someone else that you might be suited to?
Because is there a barrier there sometimes where it can be a bit awkward, or they'll avoid that, or the client feels like it's a bit awkward? Maybe it's not for the therapist, but nothing personal, I guess.
No, look, and this is it. I'm just thinking about a conversation I had on the phone with someone the other day, and they'd seen one of our other team, and I was sort of talking to them about some other work that we're doing with their business, and he made comment about the stuff that he'd been working on with our other team member. And I said, look, mate, I'm happy to reconnect you with that other psychologist because you've already got the groundwork there. And he goes, oh, I don't want to offend you. And I said, that's not what it's about, mate. It's about what works best for you. And I'm, I know the importance of that existing relationship and not having to rehash, if you like, the stories that you may have already explored with him if you're willing to continue to work with him. And so, back to that question, Callum, about what we do differently. Sure, we run our psychs through a sort of an onboarding and refresher program that talks about, the considerations around a gendered approach to therapy.
What is the importance of the gendered approach in your view? Why not cater to men and women?
There's plenty of services out there that cater to women. This can be a bit of a sensitive topic. And interestingly, we haven't had as much pushback, I guess, as I would have expected, being a sort of a a service marketed for men, at men.
Mm.
So, for us, it's about identifying what is required according to our interests and our experiences. And for us, that was a men's specific psychology service. Now, we look at the sort of the approach around how we do our business. And if we look at the stats, the people visiting our website, funnily enough, it's almost 50-50 between males and females. So, that's a really interesting stat because it also highlights the importance of how we ensure that what we're promoting appeals to the partners or the significant others of men that might require support as well.
Yeah, because that's a huge part of it all, is obviously the people around the person who might be seeking help or in need of help, is the women in their lives who need to communicate that to them or try to understand where they're at. And so we've got to think of the whole picture. Even if you're targeting men, you still have to have women in mind, of course. It's interesting. Why were you expecting that there would be some sort of pushback just because you're catering to men?
We look at the push for equality, diversity and inclusion in sort of the corporate space currently, the focus on unconscious bias. Some of the initial conversations we had with some of our advisors was, well, why are you doing this just for men? How do you sort of expect that to be received? And, funnily enough, and this is, I realise, a controversial statement, but if we talk about diversity and inclusion, one of the things that, and equality more so, is that we need an equal set of options for professional psychology support for men as well as women.
Absolutely.
And we don't currently have that.
And I mean, if it was a service that was specifically for women, I don't think there would be any problem with that, would there? So I guess it's just like, it's just necessary in certain circumstances, I think, for that gendered approach and for certain services to cater to certain groups. And that's no different to so many other examples where you have a niche and you serve that niche or that demographic that needs the service, and it shouldn't be something that is in any way controversial, I suppose. But I guess, it's the world that we're living in today. So what challenges have you guys had to overcome in setting up and keeping it going and all that?
We're only sort of 13 months old. And for us, one of the primary challenges, you said earlier that men are seeking help more than they used to. It's up sort of 10% on what it used to be, and it's growing. For us, it's still differentiating the service from crisis support services that are already out there. Lifeline's doing some great work. You've got Men's Line, you've got the suicide callback services as three primary ones. And there's some really cool stuff that Lifeline will be doing for men in the near future as well. And so, for us, it's promoting the importance of doing mental health early.
Preventative
looking for ways to proactive and preventative approach to mental health, because mental health is different to mental illness, and you can be mentally healthy and have a mental illness, and for us, what we're trying to promote is this notion of early intervention. Like any sort of health issue, is the best kind of intervention. And sort of breaking down that stigma, noting that we're a video telehealth service that sort of is associated with this not being as effective as perhaps face-to-face sessions, when all the data tells us, and we've had a really great, if there's one good thing to come out of the last sort of 20 months in around the world, is that these sort of platforms, they're not the same as face-to-face, but they're as effective from a professional perspective.
And the spotlight on mental health as well. I think COVID's really normalised that conversation a lot more, or perhaps accelerated the mental health talk, and whether that's going to be continued and backed up, it's certainly in the short term, at least, the business world seems to have taken notice of that for the first time, and it's sort of all the rage at the moment in a way, which I suppose for people providing services is a good thing. Obviously, it's not good for people to be in distress, but it's not like all these issues and people struggling didn't exist before. It's just that we're acknowledging it more now, and I hope that continues to increase. What lessons have you guys had to learn? Any tough lessons or things that you'd change?
Look, the tough lesson, and it's still a tough lesson in light of what's going on around us, Australia specifically, and more so the world, is, how do we build relationships with other health services? So, if we talk about GP practices and looking at how we build awareness around mental, that's one of our challenges. Ensuring our consistently doing work, I should say, on our user experience, our client user experience, noting that, sometimes when it is a video telehealth platform, how do we make it as smooth and as painless, more specifically, as possible for the clients? Because if there is a little bit of distress there and they're just looking to get support, how do we make sure that there's not too many hurdles to jump over?
It has to feel easy for people when they're looking for something like that. They don't want to click on one button that leads somewhere and it leads them back, and then or whatever or whatever it is, or speak to someone and feel like they're hitting roadblocks, because that might be the only time that they're going to reach out.
Yeah, that's it. And early on, I think, some of our booking processes were a little bit less streamlined than they needed to be. And it was one of the things that I love about the people that engage with us, our clients, are that, when we ask them for feedback, they're really willing to give it. And that's not just the bad stuff, that's also the good stuff as well. And so, for us, one of our sort of key values at MANTLE is reciprocity. And to me, what that means is ensuring that we're providing the best service possible. But to do that, we need to be having this conversation with people using our service, both the clients and the psychologists that provide our service, as a means to continue to improve.
What kind of feedback have you been getting from people? Hopefully mostly good.
Really positive. One of the key pieces of feedback, or the key consistent pieces of feedback that we're getting, is that our clients really appreciate the opportunity to be able to engage with a psychologist at a time and a place that suits them. And so whether that's, sitting in the office, at work at the end of a long day, or maybe in the lunch break, whether it's people going out and sitting in the car and having a conversation with one of our team whilst they're in the car, outside the job site during their lunch break, sort of that flexibility of service and the limited requirement to actually travel to see a psychologist and sit in a waiting room, which can sometimes be awkward. A great bit of info I heard, traditional psych practices, you go there and there's a stack of new ideas sitting in the waiting room. This sort of stuff makes you feel a bit uncomfortable.
Bit alienated.
New ideas, right?
Yeah. Where are you at now in terms of, are you looking to expand? Do you have enough space where you currently are? Are these sort of the considerations that you think about? I'm actually aligned with a men's psych practice here in Adelaide who've started up a similar time ago to you, and they've had a really good uptake, but they can't fit everyone in, so they have to try to find more space, which I guess is a good thing, but just there's a lot of demand, it seems.
The expansion is necessary. What we're looking at from a growth perspective is sort of tripling our figures in the next 6 months, and to do that we need more psychologists.
Yeah.
So we're very targeted with the way we approach recruitment as well, because we acknowledge, going back to that stat about men sort of having an adverse experience, we acknowledge that good psychologists have the capacity to change that experience. And so for us, it's looking at, if we look across our current team, at least 10 years experience in psychology and mental health, exposure to male-dominated workplaces, or, workplaces consisting mainly of men, is the correct way to say it. But the requirement to expand and find more psychologists is always pressing. And for us, we're lucky because it's this. We don't have to worry about sort of bricks and mortar space, but we also need to make sure that wherever our psychs are operating from, that it's that it's a suitable and space, and they have the necessary equipment to be able to operate effectively and provide a premium service.
And having the right people on the team is paramount.
100%, mate. This is relationship. And if we don't have people that can build and maintain relationships quickly, and can deal with the level of discomfort when those awkward conversations come up about fit and so forth, you're not maintaining the reputation and the brand that we strive so hard to set up.
So what do you see as the future of men's mental health in Australia in, say, the next decade?
Ooh, look,
Pretty easy question, wasn't it?
Yeah, I think I look at what the Australian Men's Health Forum is doing, and the information that they're providing to their constituents and to the broader public around how you best engage with men from a health perspective, and the unique requirements of that. So being a glass half full kind of guy, I see there's great opportunity there to shift the needle on not just this notion of reducing suicide, which at its core for those working in mental health, that's always sort of an outcome of what you're trying to do, but changing the dialogue to be more about, well, how do we promote men's mental health as something that is most effective when done early, and doing it from a preventative, proactive perspective, then that's my hope for the next 10 years, to see a dramatic uptake in services that provide an early intervention and prevention model, as opposed to a reactive crisis support model.
Don't wait till it's a crisis, and then I suppose shifting that societal attitude of men to start perceiving it that way, and then if the services are moving the same way, then that starts to shape the whole picture. But that sort of has been historically how we've looked at it, isn't it? Where it's like, okay, either you're fine or you're mentally ill and you have a serious problem. We didn't really look at the fact that the mental health obviously is spectrum, and everyone's on it, and everyone has ups and downs and needs to basically manage themselves to not end up in a hole. But that's not really how we've looked at it. It's either, oh, you've got problems, or you don't, which of course no one doesn't have to do anything. Doesn't work like that.
Mate, I mean, geez, I wouldn't have a job if that was the case.
Yeah,
right?
yeah, that's right.
It's a really interesting sort of consideration. Mental health specifically, we're building all this awareness. We know the importance of addressing periods of ill health and illness when they come up. But if we want to lessen the likelihood of decline, to lessen the likelihood of experiencing those things, then we have to be proactive. We have to sort of operate from the earliest stage to build and maintain our resources that protect us against those real periods where we will experience difficult, because that's a part of life, right?
Or even to draw an ugly analogy with the pandemic, when we know that there's a pandemic in our world, we put restrictions in place or take actions to try and stop people ending up with it, because if too many people end up in a crisis at once and the system can't manage it, and then it becomes a serious problem. But if we can put things in place to manage it so that a lot of people end up getting through without getting to that point, then we can all keep sort of ticking along.
Yeah, 100%. It's a really great way to look at it. And for us, you look at the great work being done by the range of other initiatives out there that are focusing on, men, their mental health and their health more broadly. It's also, my hope for the next 10 years as well is that there's greater integration between what we call those upstream services and the downstream services, which are the more professional services. You've got your crisis support. You've got your, this raft of great programs and initiatives that are all about providing greater awareness and greater support. The missing middle here is, what are the professional services that support both that upstream stuff and also that crisis support, to lessen the likelihood of men needing the crisis support.
Beautiful, mate. Very well explained.